A Bremerton Naval doctor accused of sexual misconduct who had his medical license suspended back in February is back on the job. After a state investigation, we've learned the medical commission ruled his care is substandard and found that he made inappropriate comments to a female patient. KOMO 4's Michelle Esteban learned he's able to treat female patients again, but under one condition. Michelle?
Well, Mary, this naval doctor, who was also a lieutenant commander with the Navy, can no longer treat female patients alone. 3 months after the state suspended his medical license amid allegations of sexual misconduct, naval doctor Stephen Bernick is back at work, seeing patients at Naval Hospital Bremerton, but with one major state-imposed mandate. He cannot treat female patients without a chaperone, and every female visit must be documented and verified with the state.
Well, physicians should always introduce the chaperone.
But the medical commission's legal director says in this case there is no mandate that Bernick must spell out why the chaperone is there. To know those details, patients would have to do some digging here at the Department of Health's Provider Credential Search. It reveals all provider complaints, findings, and recommendations. The state says in some cases doctors' offices are required to notify patients, but not always.
Well, I think that has to be handled on a case-by-case basis.
Bernick, a lieutenant commander, the head of the hospital's gastroenterology department, was accused of inappropriately touching a female patient and making inappropriate comments. This week, the state revealed after investigating the claims, it only found evidence of inappropriate texting and verbal communication. State documents reveal the doctor texted photos, one of his tattoos, his chest and biceps, asked the patient to send photos of herself, and suggested that they, quote, get together. A spokesman for Naval Hospital Bremerton told me its command staff thoroughly investigated Bernick and is following the state's guidelines. Those agreed guidelines include professional boundaries training and an intensive multidisciplinary evaluation to
help establish if he's safe to practice, or if not, what kind of intervention may be helpful, or to otherwise inform the commission about what is the most likely way to protect patients.
Now, we reached out to the hospital today for on-camera interviews, but the command staff declined any of our requests for interviews. Now, this doctor could be under the oversight of the state for the next 2 years, and during that time, it's possible that they could make modifications to those agreed guidelines. Reporting live, Michelle Esteban, KOMO 4 News.